Advise most of the girls, don't miss pelvic flow, how important it is. And this specialty will Physiotherapy started in 1953, the first college of physiotherapy in mapping, and again a new tool for sports. Okay. So we can read it.
Hello students, you are with the Physio Dose and we have the guest Dr. Ali Irani sir. You all know that the first Indian physiotherapist of the Indian cricket team. So let's begin with the session. So first question to my sir is, what is your latest achievement, because you have the many. So the first one you wanted to tell, the latest one.
On March 20th, 2025, I got a good news that I'm part of the Professional Council for Physiotherapy, me and another 4 of us.
Okay.
So that was a great achievement. So that will help us to unite the physiotherapists of the country.
Yes, sir.
And we should be happy we have a council now.
Yes.
So there'll be a separate physiotherapy council under the health ministry.
Yes.
So we could streamline a lot of things for our profession. And we have been looking this for the last maybe 30 years. We have been fighting for this, and I'm happy that I'm part of it.
Yes. So much of congratulations to sir, because he has many of the achievement. You can see all the, I can't even capture in the video that this much achievement and this much motivation they are giving to the other upcoming physiotherapists. So next question I wanted to ask, if any student after completing the BPT wanted to pursue sports physiotherapy, so what should be the choices, what things you will notice in them that they can be a sports physiotherapist?
See, one, I would like to tell the student, it's not necessary that you have to do your master's or PhD.
Yes.
Because the base of practicing in India is BPT. Once you are a graduate, you become a member of the council, become a member of Indian Association of Physiotherapy. I would always prefer to be a member of both.
Yes.
And start practicing. You are allowed to put your clinic, you are allowed to see patients.
Yes,
and unless you want, teaching also is your passion.
Yes.
So I would definitely advise do your master's degree, but do it in the subject you will love.
Yes, sir.
Everybody has a passion. Maybe my passion was sports, somebody's passion is neuro, somebody's passion is cardio, somebody's passion is only joint replacement, somebody only wants to go for spine.
Yes.
So somebody manual therapy. So whatever your passion, during internship, the passion gets crystallized.
Yes.
You are already doing internship now.
Yes, yes.
So as your posting comes, you will come to know what you loved more.
Yes.
Maybe you will say, I loved neuro more, I loved sports more, I loved aches and pains,
Yes, sir.
or back problems, knee problem. So I think so during internship you decide and you follow your passion. You do your master's in your passion, what you wanted to do.
Yes. That's the great and the important question I wanted to ask to sir. And next, let's go to the topic into the multiple choices we have in our physiotherapy profession, that we have community, we have sports, cardio, neuro, everything as sir told. So if anyone want to choose a specific sport, so what all things you have learned in the sports that this thing is unknown to the BPT student, that the MPT has included in this, like injuries, which we are unknown that we are going to study that thing. So any new thing which you wanted to add?
See, physiotherapy is improving.
Yes.
Every year that comes. We are coming up with new specialties every year. Yes. Or every 6 months, some new specialty comes. But I would say going back to the history, physiotherapy started in 1953. The first college of physiotherapy came in KM Hospital, Mumbai.
Yes,
it was a 2-year course.
Okay.
Only 10 students. So the 2 years course became 3.5, it became 4.5. We are already thinking of 5 years. We are already thinking of DPT, that is Doctor in Physiotherapy, for 6.5 years or 7 years after 12th.
Yes.
So after finishing now, thank God, all the colleges in India are 4.5 years degree college.
Yes.
So after that, there is 2 years a master's program, which you specialize. You can select neuro, ortho, sports. You can select musculoskeletal. You can select cardio. You can select sports physiology.
Yes.
So a lot of special pelvic flow. The latest from Ahmedabad was Dr. Heth and Dr. Dara started pelvic floor. I had gone to Ahmedabad to meet them and I really adored it, loved it, the work, both of them are doing it. So I would advise most of the girls, don't miss pelvic flow, how important it is. And this specialty will come up whenever you get an opportunity to do a workshop.
Yes.
Or you call them at your college. I'm sure Dr. Heth or Dhara would come and love to speak to you all about pelvic flow. Very, very important for anybody, male and female both.
Yeah, that's the great message, because we are unaware about the upcoming field and upcoming workshops and everything. We are so confused because there is so many opportunities we are getting, so we don't understand that which all step we have to follow, in which field we have to go and everything. Like, this is so confusing. So if we get a guide from such a good personality and a great a motivational speaker. So that will be so much helpful for us as upcoming physiotherapist. So my next question is, what you have learned the new thing in the MPT as a sports regarding your all experience, that how you have to approach to athletes and differentiate between athletes and patient.
See, in sports, I would put my basic aim in sports was we knew what type of injury a sportsman, depending on the sports, get. So prevention is one.
Yes.
So good warming up, good strengthening, checking the range of movement, which muscle to strengthen,
Yes.
what is the minus point of that sportsman. So,
Yes,
so
yes.
work on that. And definitely treatment becomes very easy if
Yes.
you can prevent it.
Yeah.
And anyhow, sports has injuries. Now, if it is injured,
Yes.
right diagnosis, what it is, and then plan well what to do, what
Yes.
rehab to give, or whether surgical intervention is important,
Yes.
whether you have to take an X-ray, MRI, sonography, don't compromise. Do a thorough examination, refer it to the right specialist,
Yes.
let them guide you.
Yes.
And if surgical is not required and rehab, go for the rehab, get the sportsman as soon as possible back on the field.
Yes.
But it's last many years, 8 years, I've been studying brain mapping, and again a new tool for sports.
Okay.
So we can read a sportsman brain. So we found out that when the sportsman, we have 5 zones our
Okay.
brain works.
Okay.
Delta zone, theta zone,
Yes.
alpha zone, beta zone, gamma zone.
Okay.
So we found out all the sportsmen who had performed very well,
Okay.
they were that time in alpha zone.
Okay.
And when they had not performed well, they were in gamma or beta zone.
Okay.
So to get the sportsman into alpha zone before the person goes to play
Yes.
could be a benefit.
Yes.
And we have also tried in neurological condition getting the patient into alpha zone and then treating. The recovery or the results are better.
Okay. So, sir, the person who are coming in the sports physiotherapy, everyone has a dream of coming in the Indian cricket team. So, what was your experience working with them?
No, during my time, maybe there were hardly any physiotherapists. We had only 7 colleges. When I was a student, there were only 7 colleges of physiotherapy.
Okay.
And after finishing study, I was doing my research program with Bombay Hospital, Dr. Rambai Patel.
Okay.
So, God bless his soul, Hanuman Singh was my patient, and he was the chairman of selection committee. So he said, "Okay, we are planning to select some physio for our team. So why don't you come for the interview?" So many people had applied, I don't want to name, there were many who had applied. So they had shortlisted 25, then from 25 they shortlisted 4, and from 4 we all 4 went for the interview. And in that 4 again 2 were shortlisted. And from the 2 I and my another friend were there. He was an orthopedic surgeon. So between 2, first it was decided both will go. But ICC rules said that only 14 plus, 1 manager, 1 physio or doctor. So first time they decided that they will send a physio. So I was the first physio for any sports team in India. I think so before me, no physiotherapists. Yes, doctors have been with sports team, but not a physio. So 87 was the start of Reliance World Cup, and I was the physiotherapist for Indian cricket team. And hope if I wouldn't have done well, I think so the word of physiotherapy wouldn't have gone up so much.
Okay.
Physiotherapy became popular because I was called as Ali Physio. And a lot of newspapers, a lot of magazines wrote about me. A lot of miracles were done on the field where I have treated the patient and got the sportsman back into the game.
Yes.
So unless we proved ourselves, our profession proved that yes, we are important and we are part and parcel of any sports team,
Yes. So that was a great experience he shared, and after all this, he created a history, and he wrote a history with which all the physios have a dream of being that part. And next, what all things that how you have prepared yourself for that all emergency at the pitch level, like while the match is going on, that how much preparation you have to be at the time, that how much injury can happen. So what all things you have to prepare with your instruments
and
and
everything. We have to
everything.
think of the worst before
Okay.
going the ground. We have to think of the worst, whether India or abroad.
Okay.
Nearest hospital available, doctor available, whether ambulance is there, because God forbid anything could happen. We thought of the worst.
Yes.
And thank God nothing great happened. Till at least in my tenure of 10 years, it was there nothing. There was no fatal accident. Yes, there were fractures, there were a lot of cuts, there were wounds,
Oh.
which I could take the patient. But yes, my backup team was ready. We used to arrange everything beforehand only,
Okay.
so not to look for things at the last moment.
So do you have any training for this, or BPT is getting all these domains are covered up in this?
That my era it was self-training.
Okay, that was a great right.
Now everything is on a platter. Now we
Yeah,
tell everything.
yes,
We tell our
exactly.
students what all to do.
Everything
So
is
it's ready.
spoon feeding right now, but at that time it was very difficult because that field was unknown, and he was the first person, and many, as he told, that there was no such a medical college that they were giving such opportunities, and they were not having to learn this much thing. So it is very motivating for me, and very blessed to sitting next to him and taking his interview. So
Thank you, Gayatri. I could not refuse her coming. One, I knew she's studying in Nasik.
Yeah.
And when she had asked for an appointment, कि whether can I come and meet you and ask you a few questions. So it was a Saturday and it was really
Yes.
nice of her to come. And I'm happy that I could answer her question and hope this interview will reach to all the physiotherapy students all over Maharashtra and India.
Yes,
of
of
course,
course.
even abroad. And I wish her all the best. She has to complete her internship and hope she's from Mumbai. So look
Yes.
forward to see her back in Mumbai.
And working with sir.
And I would only request all the physios, please work hard, study. And I can only pray, that may God give you all a healing hand. We should all have a healing hand. I'm going to follow Physio Dose channel. Please you all also subscribe and follow it. Thank you.
Thank you so much.